Health is our most precious gift. We all dream of living a long, happy, and active life, but often, we don't realize that our everyday choices and small habits can make a big difference in our overall health. Just like we invest in good clothes, gadgets, and outings, we also need to invest in our health, not just when we fall sick, but before that. This is where the real magic of health screening, prevention, early treatment, and mental wellness comes in. Let's take a simple, honest journey to understand how we can take better care of ourselves and our loved ones together. 1. Prevention is better and cheaper than cure. You may have heard this phrase before, but let's decode what it truly means. Prevention is not only about avoiding illness, it's about building a strong foundation of health through balanced diet, exercise, regular checkups, mental wellness, and vaccines. Let's take an example. Diabetes and high blood pressure are two common conditions in our society. Many people don't even know they have them until serious complications like heart attacks, strokes, or kidney damage occur. But these conditions can be easily detected early with regular screenings and managed with simple lifestyle changes and medicines. In fact, according to the World Health Organization, WHO, up to 80% of heart disease, stroke, and type 2 diabetes cases can be prevented by addressing a few lifestyle factors like unhealthy diet, physical inactivity, and tobacco use. 2. Health screening, the secret weapon. Think of health screening as a regular service check for your body, just like we do for our cars. If a small issue is caught early, it can be fixed before it turns into a big, expensive problem. Here are some important screenings everyone should consider. 1. Blood pressure. After age 18, check it yearly. 2. Blood sugar, HbA1c, especially if you're overweight or over 40. 3. Cholesterol levels, starting from age 35 or earlier if you have risk factors. 4. Pap smear and mammogram, for women, to detect early signs of cervical and breast cancer. 5. PSA, for men over 50, for early detection of prostate cancer. 6. Colonoscopy, after age 50 to detect colon cancer. 7. Liver and kidney function tests, especially if you use medications regularly or have chronic conditions. 8. Vitamin D and B12 levels. Deficiencies are very common but often go unnoticed. Most of these tests are not expensive, especially when compared to what we usually spend on a single shopping spree, a dinner at a fancy restaurant, or a new phone accessory. Just think, if we can spare money on shopping each month, why not use even a part of that for an annual health check? It might save your life or the life of someone you love. 3. Timely help saves lives, especially in mental health. Mental health is often ignored, even though it affects how we think, feel, and act. Conditions like depression, anxiety, and stress are now more common than ever, especially after the COVID-19 pandemic. Unfortunately, many people suffer in silence, afraid to talk about what they are going through. But just like physical health, mental illness is real, and it is treatable. If you or someone you know feels persistently sad, hopeless, anxious, or has trouble sleeping or concentrating, it's important to speak to a doctor or counselor. Timely help can save lives. Here's a real-life example. A 30-year-old woman came to the clinic feeling tired, losing interest in daily tasks, and crying often. She thought she was just being weak. After proper counseling and treatment, her life completely changed. She got back to work, started enjoying family time again, and regained her confidence. Lesson: mental health is just as important as physical health. Don't ignore it. Don't be ashamed to ask for help. 4. When you act early, you heal faster. Let's talk about early detection of major illnesses like cancer, kidney disease, or heart conditions. When detected early, 1. Cancer can be treated with less aggressive treatments. 2. Kidney disease can be slowed down, preventing the need for dialysis. 3. Heart disease can be managed with medication, avoiding risky surgeries. One of the biggest mistakes people make is delaying doctor visits. Many people wait until the pain is unbearable or the disease has already spread. Why? Often because of fear, time, or cost. But the cost of delay is usually much higher, financially and emotionally. A patient once said, "If only I had done that test 6 months ago, I wouldn't have needed surgery now." That regret is what we want to prevent. 5. Small habits, big results. Let's talk about some simple habits you can start today that make a big difference over time. 1. Walk 30 minutes a day. Walking can reduce the risk of heart disease and improve your mood. 2. Drink more water. It helps your kidneys, skin, and overall energy. 3. Sleep 7-8 hours. Your brain and body heal during sleep. 4. Eat more fruits and vegetables. They are packed with natural vitamins and fiber. 5. Avoid smoking and limit alcohol, major causes of cancer and liver disease. 6. Practice gratitude and mindfulness. They help keep your mind calm and focused. Remember, consistency is more important than intensity. A small step daily is better than a big step once a year. 6. Learn from those around you. Look around your family or community. You'll always find examples of people who paid the price of ignoring their health, or those who benefited from taking it seriously. 1. A neighbor who caught cancer early thanks to a routine mammogram is now cancer-free. 2. A friend who lost his father to a sudden heart attack now gets yearly checkups and encourages others too. 3. A woman who ignored her diabetes for years ended up with poor vision and kidney problems. These are not rare stories. They are happening every day. The good news? You can choose differently. 7. Your health is an investment, not an expense. We often hesitate to spend money on medical tests or doctor visits, thinking, I'll go later, or it's probably nothing. But just like you insure your car or home, your body needs care too. A health checkup may cost you Rs 3,000 today, but skipping it could cost you Rs 300,000 later. And more importantly, the stress and suffering that comes with a late diagnosis. Lesson: treat your health like your most valuable asset, because it is. Final thoughts. Let's walk this journey together. Health doesn't have to be confusing. You don't have to be a doctor to take care of yourself. You just need the right mindset, basic knowledge, and timely action. Let's make a pact. 1. To go for regular checkups. 2. To take our mental health seriously. 3. To help our family and friends do the same. 4. And to talk openly about health, not just when we are sick, but before that. Let's decode health together, one step at a time, one habit at a time. Your future self will thank you.